You're sitting in a modern dental office under soft white lights. The air smells faintly of disinfectant. The dentist, wearing gloves, picks up a tiny needle and gently injects local anesthetic into your gums. A few minutes later, the pain that kept you awake all night begins to fade. First, it blurs. Then it disappears, almost like someone flipped a switch. Today, a toothache is usually just a hassle. It ruins your sleep. It interrupts your work. It costs money. It forces you into an appointment you would rather avoid. But for most of human history, a toothache was not a minor inconvenience. It could mean days without sleep, days without chewing, days without chewing. And if the infection spread, it could mean something far worse. Today, we're afraid of going to the dentist. For most of history, people were afraid there was no dentist to go to. So how did people survive toothaches before dentistry existed? To understand that, we have to go far back, long before clean dental offices, X-rays, antibiotics, and modern anesthesia. We have to look at the skulls our ancestors left behind. And the first surprise is this: early hunter. Gatherers often had fewer cavities than the farming societies that came later. Not because they brushed their teeth, not because they had toothpaste, and not because they knew some secret ancient dental routine. Their diet was simply different. Before agriculture, humans ate meat, nuts, wild fruits, roots, tubers, and other rough foods. They did not have refined sugar. They did not have soft processed snacks. They did not have sticky starches sitting between their teeth all day. That meant oral bacteria had less easy fuel to turn into acid. But that does not mean their teeth had an easy life. Their food was tough, gritty, and often full of tiny particles of sand, ash, dust, or stone. Many people also used their teeth as tools. They bit leather, they tore fibers, they held cords, they cracked hard foods. For many early humans, teeth were not just for eating. They were a third hand. So while early hunter-gatherers may have had fewer cavities, they still dealt with worn-down teeth, cracked enamel, gum disease, exposed roots, and infections. Then came one of the biggest changes in human history: agriculture. Around 10,000 years ago, people in different parts of the world began settling down and farming grains and starchy crops. This changed everything. It gave humans more stable food supplies. It helped villages grow into towns and towns into cities. It made civilization possible. But it also changed what happened inside the human mouth. Starchy foods could stick to the teeth. Bacteria could break those starches down into acids, and those acids could slowly eat away at enamel. As farming spread, cavities became more common, and in a world without dentists, a rotting tooth was not just painful. It was dangerous. Imagine a person thousands of years ago, lying awake in a dark hut. The fire is almost out, outside. There is no streetlight. No hospital, no emergency room, no phone to call for help. Half their face is swollen. A rotten tooth feels like something is beating inside the jaw. Every pulse sends pain toward the temple. They cannot eat. They cannot sleep. They can barely speak. They do not know what bacteria are. They do not know about pulpitis. They do not know what an abscess is. They only know one thing: this tooth is torturing them. And for a long time, humans explained that torture in a way that made perfect sense to them. They blamed tooth worms. Across many ancient cultures, from Mesopotamia to China, India, Egypt, and medieval Europe, people believed that tiny invisible worms could burrow into teeth. These worms were thought to gnaw, wriggle, and drill holes inside the tooth, causing that deep, pulsing pain. Today, the idea sounds absurd. But imagine not knowing the inner structure of a tooth. Imagine feeling a sharp, throbbing, drilling sensation inside your skull. The toothworm theory suddenly feels strangely logical. If it feels like something is drilling inside your tooth, maybe something really is. So people tried to drive the worms out. Some prayed, some chanted, some used herbs, resins, tree bark, smoke, and strong smelling mixtures. In parts of medieval Europe, one strange treatment involved fumigating the tooth with henbane seeds. The patient would open their mouth over smoke, hoping the fumes would force the worm to leave. When the seeds burned, they could leave behind small white residues. To someone expecting to see worms, those little pale fragments might look like proof. The worm had come out. Except, of course, there was no worm, only plant residue. And the tooth kept rotting. But not every old remedy was completely useless. Some plants really could reduce pain for a short time. Clove oil, for example, was used for tooth pain because it can create a numbing effect. Certain herbs, tree barks, alcohol, and plant extracts may also have offered temporary relief. But they all had the same limitation. They could quiet the pain. They could not fix the cause. If the inside of the tooth was infected, numbing the area did not remove the infection. It was like closing a window during a house fire. Maybe less smoke gets in your face, but the fire is still burning. And when the pain got worse, when the face began to swell, when fever appeared, the final option was often brutally simple. Pull the tooth out. This was the most frightening part of life before modern dentistry. For much of history, tooth extraction was not always performed by a trained dental professional. In medieval and early modern Europe, barber surgeons, traveling tooth pullers, and practical healers often did the job. They might work in markets, on street corners, in military camps, or inside a patient's home. No modern dental chair, no stereo room, no local anesthesia, no antibiotics. Sometimes the only preparation was a few drinks of alcohol, or several people holding the patient down. The tools might be pliers, early forceps, a dental key, or other metal instruments. The operator would grip the diseased tooth, rock it back and forth, and pull. If the tooth came out cleanly, the pain might finally stop. But if the root broke off, or the gum tore badly, or the wound became infected, the real danger was just beginning. Because the scariest thing about a tooth infection is not the pain. It is the spread. A tooth is not a dead stone in your mouth. Inside are nerves, blood vessels, and soft tissue. When bacteria reach deep into the tooth, infection can move through the root, into the jawbone, the face, the neck, and in severe cases, the bloodstream. Today, dentists and doctors can usually treat this with drainage, root canals, antibiotics, or extraction. But before antibiotics and modern surgery, severe dental infections could be fatal. Historically, tooth infections really did kill people. So for people in the past, a bad tooth was not a small problem. It could stop you from eating. It could weaken you. It could swell your face. It could give you a fever. It could turn one aching tooth into a whole body crisis. This is why the rise of modern dentistry was not just about making people more comfortable. It changed how humans dealt with pain, infection, and fear. In the 18th century, a French physician named Pierre Fauchard published The Surgeon-Dentist. He is often called the father of modern dentistry. Fauchard did not know everything modern science knows today, but he helped move dentistry away from superstition and toward observation, tools, technique, and anatomy. He rejected the old toothworm explanation and described dental disease in a more systematic way. Humans began to understand that toothache was not a curse, not a worm, not fate. It was a problem. A problem that could be observed, explained, and eventually treated. But understanding the problem did not instantly remove the pain. The real leap came with anesthesia. In 1846, William T.G. Morton, a Boston dentist, publicly demonstrated ether anesthesia at Massachusetts General Hospital. The event changed medicine. For the first time, people could clearly imagine a future where surgery did not have to mean being awake for every second of pain. Pain was no longer the unavoidable price of treatment. After that, dentistry kept changing. Local anesthesia, X-rays, stereo techniques, antibiotics, root canal therapy, modern instruments, preventive care. Dentists were no longer just people who pulled bad teeth. They could diagnose, preserve, repair, and prevent. What modern dentistry truly changed was not just the tools. It changed the meaning of a toothache. For most of history, tooth pain was something you endured. Today, it is something you investigate. You locate it, you numb it, you treat it. You prevent it from coming back. And that is easy to forget. Because today, we still complain about the dentist. We complain about the cost, the waiting room, the needle, the drill, the sound. But if you go back just a few hundred years, or a few thousand, the truly frightening thing was not the drill. It was having no drill at all, no anesthesia, no antibiotics, no trained dentist, no clear explanation, no one who could calmly tell you what was happening inside your mouth. So the next time you walk into a bright dental office with a toothache, imagine one of your ancestors sitting in a dark room, half their face fallen, unable to sleep, waiting for morning, hoping someone nearby had the strength and tools to pull the tooth out. What would they have given for the few minutes of numbness we take for granted? Modern civilization is not always about skyscrapers, machines, cars, or the internet. Sometimes, civilization is much simpler than that. It is the moment when someone is in so much pain they cannot sleep, and another person can calmly say, "Open your mouth, we know what to do."